Let me tell you something that I wish someone had told me earlier. Concierge practice is not a practice style. It's a business model. And if you want to build it successfully, you're not just becoming a better doctor. You're becoming an entrepreneur. Concierge sounds incredible. More control, better patients, better outcomes, less burnout. You get to practice medicine the way you always imagined. And yes, all of that can be true, but here's the part nobody tells you. To actually pull it off, you have to solve a long list of problems. And most of them have nothing to do with surgery at all. So here's the roadmap, what it actually takes. First, you have to form a company. This means deciding LLC, S Corp, C Corp, and you can't just guess. You need a CPA involved because the tax implications now versus later can be completely different, especially as your revenue grows. Then you need an attorney because you're not just starting a practice, you're founding a company. You need formation documents, operating agreements, bylaws, all the stuff nobody teaches you in residency. Next, you have to build an actual offer, not the medical part, the business part. What actually does the patient get? How is it priced? What's included? What's not included? What are the boundaries? What are the rules? Then you need products. And here's the catch. They need to be aftermarket and uninsured products, which means you need vendors. And vendor relationships aren't magic. They're built through conference calls, emails, meetings, negotiation, and trial and error. Then comes marketing. You have to learn how to make an offer. You have to learn how to explain it. You have to learn how to sell it without sounding salesy. You have to learn psychology. You'll read books on persuasion and sales because nobody's going to do that for you. Then you need a website. Not just a website that can convert. A website that tells your story. A website that makes patients trust you. You need a mission statement, a vision statement, a philosophy of care. Then you need to understand the tax side again, because concierge medicine is not the same as insurance-based medicine. You need to understand how revenue flows, how taxes are applied, what to track, what to save. Then you have to build operations, because once a patient says yes, the real work begins. You need onboarding, customer success, automation, follow-ups, systems. You need a concierge experience that is consistent, not random. And then there's the final part nobody talks about. You have to decide if you want a second job, because that's what this becomes. At first, it's nights, weekends, early mornings, and it's not just time, it's stress. It's decision making. It's the mental load of building something from scratch. You can do this the hard way. You can spend the next 2 to 5 years building concierge from scratch, forming a company, building the offer, negotiating vendors, writing your policies and building systems and learning marketing and sales and creating your website and fixing the mistakes that inevitably will occur and rebuilding and slowly figuring out what actually works. Or you can do it the NAOKA way. We'll do that for you. It's 4 easy steps. Step 1, you can engage NAOKA through your existing LLC or create one if you need. Step 2, you can build your concierge offering with NAOKA. You can use our structure, pricing, boundaries, and systems. 3, you can present the offer using the NAOKA method, a time-tested framework that actually converts. And 4, you can start enrolling patients and getting paid for your value. That's the difference. Years of trial and error versus a proven system. So, if you're serious about concierge medicine, here's my honest advice. Don't wing it. Don't piece it together from podcasts and late-night Google searches. Use a roadmap, because the difference between the surgeons who succeed and the surgeons who quietly give up isn't talent. It's having a system.